My reaction this morning is just one of sorrow and discouragement. I think a very, very serious mistake was made yesterday. It will lead certainly to higher taxes, higher health care costs, and a much weaker economy going forward. But the Congress was determined, and now we'll live with the consequences. The first consequence is for Indiana is that we'll suspend enrollment in our HIP program, which will be annihilated by this new bill. I've asked Secretary Murphy to think about an orderly termination of this program, and that's very sad because it's bringing peace of mind and of health insurance to 50,000 low-income Hoosiers now. So we'll look at the best way to wind it down over the course of time. It will subsidize people. It will force people into Medicaid, and then above that offer a subsidy. There's no room in this bill for personal responsibility. There's no room for innovative programs like HIP. And I think it's a sad thing, but the federal government has now taken over an additional 18% of American life and the American economy, and we'll just simply have to surrender to that reality.
But Governor,
what's wrong is placing enormous new taxes on the job generators of small business and investment, huge new taxes on the next governor of this state is going to be faced with a massive new Medicaid cost that we don't face now, and that is an additional tax which will be paid through your state sales and income taxes. There were so many better ways to do this that could have empowered Americans, as the Healthy Indiana plan does, to look after their own health care, could have given them the tax benefit now given to employers, as opposed to a nationalized system that we will now be forced to move into. I think this bill will drive physicians away from the Medicaid program. What you're already seeing in Medicaid is people who technically are covered but can't find a doctor. And we will, under this bill, we will have 1 in 4 Hoosiers on Medicaid. It's not the best health care, and it will be probably worse then than it is now.
Well, how will increasing the reimbursement rate drive physicians away from that program?
First of all, this is one of the fraudulent assumptions, and I would use a weaker word if one were called for, but it is absolute fraud not to admit that this will add trillions to the future debt that we're leaving to our children. And one reason is they're pretending they're going to restore or raise physician reimbursement. They're going to raise those rates, and they're going to, in the process, unwind the supposed fiscal premise of this bill.